Okay, guys, now today we will be discussing about the endocrine system. Sensory information and body's response or reaction to it. Actually, there are two physiological systems which are responsible for transmitting and interpreting sensory information while orchestrating the bodily reactions to that information. And those are nervous system and the endocrine system. Collectively, we call them neuroendocrine system. The endocrine system governs bodily functions by discharging hormones, which are chemical messengers into our bloodstream. Those hormones, they circulate throughout the entirety of the body. Hormonal circulations can manifest almost immediately, or it could be delayed. Means it may transpire over the course of several days or even several weeks. Well, it produces a broad spectrum of effects. Hormones are the chemical substances which are produced by various glands in the body, typically located in the endocrine system. These substances are secreted directly into the bloodstream and act as messengers traveling throughout the body to regulate various physiological processes and maintain the homeostasis. Like the cell-producing hormone, it will be entering into the bloodstream, then it will be carried close to the target cell, and then through the interstitial fluid, it will be affecting the target cells. Hormones, they regulate the chemical composition and volume of the internal environment, that is extracellular fluid. They assist in regulating metabolism and maintaining energy balance. They aid in controlling the contraction of smooth and cardiac muscle fibers, as well as secretion by glands. They assist in maintaining homeostasis even in the face of disruptions such as infection, trauma, emotional stress, dehydration, starvation, hemorrhage, and extreme temperatures. They regulate certain functions of the immune system. They facilitate the smooth and sequential progression of growth and development, and they contribute to fundamental processes of reproduction, including gamete production, fertilization, embryo and fetal nourishment, childbirth, and the care of the newborn. There are two types of glands in our body. The endocrine glands they differentiate for two genders at certain levels. Exocrine glands, they are also having just some additional effect or some additional function in females, but otherwise all other glands, they work almost similar. Target cells and the receptors. Target cells are specific cells within the body that are equipped with receptors capable of recognizing and binding to particular hormones or signaling molecules. This is the signaling cell producing the hormone which will enter the bloodstream, carried to the target cell. These receptors are often proteins located on the surface of the cell membrane or within the cell itself. When a hormone binds to its corresponding receptor on a target cell, it initiates a series of biochemical reactions or signaling cascades within the cell, ultimately leading to a specific cellular response. Receptors are specialized proteins that serve as docking sites for hormones or neurotransmitters. Well, these receptors are highly specific, meaning they can only bind to particular hormones or ligands that have a complementary shape and chemical structure. Once bound to the receptor, hormones can trigger various intracellular signaling pathways altering the activity of the target cell and regulating its function. Receptors can be found on the surface of the cell membrane, in the cytoplasm, or within the cell nucleus, depending on the type of hormone and its mode of action. Now, let's discuss the different glands and their secretions. So, secretions from the anterior pituitary gland. Pituitary is divided into two parts, the anterior part and the posterior part. And both the parts, they are secreting different hormones. Secretions from the anterior pituitary. Growth hormone is one of those hormones which are secreted from the anterior pituitary and is essential for the growth and development of bones, muscles, and other organs. It also enhances protein synthesis, decreases the use of glucose, and promotes the fat destruction. Well, if there is an hyperplasia of the anterior pituitary and it will be secreting the growth hormone in excess and beyond the age when it is required, then it may lead to gigantism, or the term which we use for another type of problem called acromegaly. And if it is not in sufficient amount and is not produced at the proper time when it is required for the growth, then there would be a chance of a person having dwarfism. We are discussing about the secretions from the anterior pituitary gland. Then adrenocorticotrophin hormone, ACTH. It is essential for the growth of the adrenal cortex, as well as thyroid stimulating hormone, which is essential for the growth and development of the thyroid gland. Secretions of the anterior pituitary we are discussing. Another hormone is follicle stimulating hormone, which is a gonadotrophic hormone. It stimulates the growth ovarian follicles in the females and the production of the sperm in the males. Luteinizing hormone is also one of the secretions of the anterior pituitary, and it is again a gonadotrophic hormone stimulating the development of corpus luteum in the female ovarian follicles and the production of testosterone hormone in the male. The yellow corpus luteum remains after ovulation. It produces estrogen and the other hormone progesterone. We are discussing about the secretions from the anterior pituitary. In females, prolactin, it is also being produced in the anterior pituitary, which stimulates the development and growth of the mammary glands and milk production during pregnancy. The sucking motion of the baby, it stimulates prolactin secretion from the anterior pituitary. Well, melanocyte stimulating hormone is also one of the production of the pituitary gland. It regulates skin pigmentation and promotes the deposition of melanin in the skin after exposure to the sunlight. Now the secretions from the posterior lobe of the pituitary gland. ADH, antidiuretic hormone. It stimulates the reabsorption of the water by the renal tubules. Hyposecretion of this hormone can result in diabetes insipidus, a lot of urination. Secretion from the posterior lobe of the pituitary gland, oxytocin. It stimulates the uterus to contract during labor, delivery, and parturition. A synthetic version of this hormone is used to induce the labor, which we call pitocin. It also stimulates the mammary glands to release the milk. Now, secretions of the pineal gland. The pineal gland is pine cone shaped and only about just 1 centimeter in diameter. Very small gland, but very, very important, because it regulates our circadian rhythm and affects our normal daily routine. Melatonin is the hormone it produces. It communicates information about environmental lighting to various parts of the body and has some effect on sleep-awake cycles, as I told you, the circadian rhythm and other biological events connected to them, such as a lower production of gastric secretions while we are sleeping or while we are resting. Secretion from the pineal gland we are discussing. Another one is serotonin. Serotonin is a neurotransmitter that regulates intestinal movements and affects appetite, mood, sleep, anger, and our metabolism. Secretions of the thyroid gland. Thyroid gland plays a very vital role in our metabolism and regulates the body's metabolic processes. Calcitonin. It influences bone and calcium metabolism, maintains a homeostasis of calcium in the body plasma. Then thyroxine, T4, and triiodothyronine, that is T3. These are essential for our basal metabolic rate, the rate at which a person's body burns the calories while we are at rest. Influences physical, mental development and growth. Hyposecretion of T3 and T4 will cause cretinism in the children, that is juvenile hypothyroidism or congenital hypothyroidism. Myxedema, which is hypothyroidism among the adults, and Hashimoto's disease. Like actually we can say that due to Hashimoto's disease, there will be hyposecretion of T3 and T4. Hypersecretion of T3 and T4 will lead to Graves' disease, goiter, Basedow's disease, etc., etc. Secretions of the parathyroid gland. The two pairs of parathyroid glands are located on the dorsal or backside of the thyroid gland. They secrete parathyroid hormone, which plays a role in the metabolism of phosphorus. Too little results in cramping, too much results in osteoporosis or kidney stones. It also regulates our calcium metabolism. Not the metabolism, but you can say the serum calcium level. Then comes the islets of Langerhans. The islets of Langerhans, they are small clusters of cells which are located in the pancreas. Secretions from the islets of Langerhans. Alpha cells, they facilitate the breakdown of glycogen to glucose. This elevates the blood sugar. Glucagon. Alpha cells, they do that. Then glucagon and insulin, the delta cells, they suppress the release of glucagon and insulin. Beta cells, they secrete the hormone insulin, which is essential for the maintenance of normal blood sugar levels. Inadequate levels results in diabetes mellitus. Adrenal glands. As the name suggests, renal is for kidney. Adrenal, they are close to or in vicinity of the kidney, rather they are attached to the kidneys. These triangular shaped adrenal glands are located on the top of each kidney. The inside is called the medulla and the outside layer is known as the cortex. So both the parts, they secrete or release the different types of steroids. Secretions from the adrenal cortex, cortisol, regulates carbohydrate, protein, and fat metabolism, has an anti-inflammatory effect, helps the body cope during times of stress. Hyposecretion results in Addison's disease. Hypersecretion results in Cushing's disease. Whereas corticosterone, like cortisol, it is a steroid. It influences potassium and sodium metabolism. Now, secretions from the adrenal cortex, aldosterone, essential in regulating electrolyte and water balance by promoting sodium and chloride retention and excretion of potassium. Androgens, these are several hormones, including testosterone. They promote the development of secondary sex characteristics in the male, and their production is regulated by our adrenal cortex. Though the testosterone, they are produced in the testes, but it is also regulated by the adrenal cortex. Secretions from the adrenal medulla. Dopamine is used to treat shock. It dilates the arteries, elevates systolic blood pressure, increases cardiac output, and increases the urinary output. Adrenal medulla, epinephrine. Epinephrine, the most important hormone, it is also known as adrenaline. It elevates systolic blood pressure, increases heart rate and cardiac output, speeds up the release of glucose from the liver, hence giving a spurt of energy, dilates the bronchial tubes and relaxes airways, and dilates the pupils to see more clearly. It is often used to counteract very acute allergic reaction, which we call anaphylaxis. EpiPen can be used for counteracting all the physiological events which are going on due to some anaphylaxis or acute allergic reaction. We are discussing secretions from the adrenal medulla. Norepinephrine, like epinephrine, is released when the body is under stress. It creates the underlying influence in the fight or flight response. As a drug, however, it actually triggers a drop in our cardiac rate. Secretions of the ovaries. The ovaries, they produce several estrogen hormones and progesterone. These hormones prepare the uterus for pregnancy, promote the development of mammary glands, play a role in the sex drive, and develop secondary sex characteristics among females. Estrogen is essential for the growth, development, and maintenance of female sex organs, as well as it is also essential for the bone mass. Secretions of the testes. The testes, they produce the male sex hormone called testosterone. It is essential for normal growth and development of the male sex organs. Testosterone is responsible for the erection of the penis as well. Secretion of the placenta. During pregnancy, the placenta serves as an endocrine gland. It produces chronic gonadotropin hormone, estrogen, and progesterone. Secretions of the GIT. The mucosa of the pyloric area of the stomach secretes the hormone gastrin, which stimulates the production of gastric acid, and that is required for our digestion. The mucosa of the duodenum and jejunum secretes the hormone secretin, which stimulates pancreatic juice, bile, and intestinal secretions. Now, secretions of the thymus. Thymus gland has two lobes and is part of the lymphatic system. It is a ductless gland. It secretes thymosin. This is necessary for the thymus normal production of the T cells for the immune system. So over here, we are done with our today's lecture.